Today, we're diving into esophageal cancer. It's a really aggressive disease, and the fight for survival, well, it depends on a super sophisticated, multi-pronged approach to understanding and treating it. And just to get a sense of why this is so critical, look at this number, 15 to 20%. That's the overall 5-year survival rate. It's a really stark figure, and it tells you right away why every single advance we make in detection and treatment is so incredibly important. So we're going to break this down into 4 parts. First, we'll look at the 2 very different types of this cancer. Then, we'll follow the path from the very first symptom to a real diagnosis. After that, we'll talk about how doctors stage the battle. And finally, we'll explore the modern multimodal attack doctors use to fight it. Okay, let's get into it. It is absolutely crucial to understand that esophageal cancer isn't just one single disease. Over 95% of cases are one of 2 main types, and they each have a completely different story.
So you've got these 2 types, and they're separated by where they show up, what causes them, and even where in the world you find them. On one hand, you have squamous cell carcinoma, or SCC. This one usually forms in the upper part of the esophagus. It's the most common type worldwide, and it's linked to direct irritants, things like smoking, heavy drinking. On the other hand, you have adenocarcinoma, or AC. This one tends to develop in the lower third. And this type is now the big one in Western nations, and its rise is really a story about our modern lives. It's tied to chronic issues like acid reflux, or GERD, and obesity.
So, if these cancers have different causes and different locations, how do they first show up? What are the red flags that get the whole investigation started?
The most common symptom, by far, is something called progressive dysphagia, which is just a fancy way of saying a growing difficulty with swallowing. It often comes along with pretty significant unintentional weight loss. And the really tragic part is, by the time these symptoms are obvious, the disease is often pretty far along.
And here's the real problem. The esophagus is elastic. It can stretch. So what that means is a person might not feel any trouble swallowing until the tumor has already blocked off nearly 2/3 of the passageway. The cancer gets this massive head start before the first alarm bell even goes off.
So when a patient shows up with these kinds of symptoms, how do doctors figure out for sure what's really going on inside their esophagus?
The key tool here, the one that gives the definitive answer, is an upper endoscopy. Basically, a flexible tube with a camera goes down the throat. This lets doctors see the inside of the esophagus directly, spot any suspicious areas, and, most importantly, take a biopsy, which is a tiny tissue sample they can analyze.
And these images give you a pretty good idea of what a doctor might be seeing. The cancerous tissue often looks irregular and what they call friable, which means it's fragile and it bleeds really easily. And that's exactly why they need that biopsy, to confirm, down at the cellular level, that yes, this is cancer.
All right, so once that biopsy comes back positive for cancer, the next critical step is staging. You can think of this as creating a map of the battlefield, figuring out exactly how far the cancer has spread so they can come up with the best possible plan of attack.
To do this, doctors use a whole arsenal of powerful imaging tools. A CT scan of the chest, abdomen, and pelvis checks for spread to distant organs like the liver or lungs. Then there's an endoscopic ultrasound, or EUS, which is crucial for figuring out the tumor's depth, like how deep it's grown into the wall of the esophagus. And finally, a PET CT scan can light up any area in the body with high cancer activity, helping to find any distant spread.
All of that information from the scans gets boiled down into what's called the TNM staging system. It's pretty straightforward. It just answers 3 basic questions. T is for tumor, how deep is it? N is for nodes, has it gotten into the nearby lymph nodes? And M is for metastasis, has it spread to distant parts of the body?
Now that TNM stage isn't just some label. It's literally the blueprint for the entire treatment strategy. And the way we fight it now is rarely just one thing. It's what we call a multimodal attack.
So let's say you get lucky, and the cancer is caught super early. We're talking stage T1A, where it's just in the very top layers of the lining. The goal then is simple. Get it out completely, but with the least invasive method you can.
For those really small, superficial tumors, doctors can sometimes remove them using a technique called endoscopic mucosal resection, basically taking the cancer out right through the endoscope. For slightly larger tumors that still haven't spread, the standard approach is an esophagectomy. That's the surgery to remove the affected part of the esophagus.
But for most patients who show up with more advanced disease, the standard of care is a powerful, 3-pronged attack called trimodality therapy. First step, they use what's called neoadjuvant chemoradiation. That's chemo and radiation given before surgery to shrink the tumor. Step 2 is the surgery itself, the esophagectomy. And step 3 can sometimes involve adjuvant therapy, which is extra treatment after surgery to mop up any cancer cells left behind.
And this is where the story gets a lot more hopeful. That third step, adjuvant therapy, is being totally revolutionized. There was this landmark study called the Checkmate 577 trial. It found that for patients who still had some cancer left after surgery, giving them the immunotherapy drug nivolumab literally doubled the time they were free of the disease. I mean, that is an absolute game changer.
And this chart really just drives home why the stage of the cancer is everything. Look at this. When it's still localized, the 5-year survival rate is around 41%. If it spreads regionally, that number drops to 23%. And if it's spread to distant sites, it's just 5%. This is exactly why every single step, from catching it early to hitting it hard with multimodal treatment, is so incredibly vital.
So,